So good afternoon, everyone. Welcome to this session. It's great to see that we have so many interested in our topic this afternoon. The topic for this part is optimizing the PSW role, and how more appropriate than for us in long-term care to be looking at the role of our PSWs. Those are our hands-on and our direct contacts with our residents. My name is Marg Toney. I'm Vice President of Resident Services for Leisure World Senior Care. And today I have the privilege of introducing to you 4 individuals who are going to share their nuggets with us on PSW's roles. I will introduce each individual of the organization first, and then I would ask that you hold your questions until the end, and then we do have time for a question and answer period. I'd like to thank our sponsors for this session, Remedy RX. And the first 2 speakers that we have this afternoon are Sandra Tudge, a research associate at St. Elizabeth, and is a member of the research team examining PSWs and stroke best practices. And also with Sandra, we have Justine Giosa, and she's also a member of that research team. So I will turn it over to these 2 ladies and see what gems they can give us. Thank you.
Thank you and welcome to our presentation of talking about the opportunities for PSWs to have enhanced integration in stroke care based on a research project that St. Elizabeth and Red Cross Care Partners were involved in together. Oops. Sorry, I knew I would do that, advance it. First of all, I'd like to speak to the slide before this, and apparently we can't go backwards, so I will bear with me for a minute. Before we get started, I'd like to share with you a little bit about St. Elizabeth Healthcare. Some of you may not be familiar, as we are known more in the home care world than in the long-term care world. We were established in 1908 and have more than 6,000 staff across Canada with 5 million healthcare visits annually. We are involved in nursing, personal support, rehabilitation, and First Nations work. We've also been involved in home care research for about a decade now, but recently we established a research center, and we're the only nonprofit organization of its kind doing this kind of applied research for improving care in Canada. We have 5 priority areas: person-centered care research, personal support research, end-of-life care, rehabilitation, and knowledge translation and best practice guidelines. We've recently expanded to 10 researchers, and we're involved in many projects, and the project we're going to speak to today is involved in the personal support area. So over the course of the next 15 minutes or so, we would like to provide for you a brief summary of our research project, and then speak to a framework that was developed from that research, which helped us describe the PSW role as part of an integrated member of the stroke team. We would like to highlight for you an example. It was a descriptive study, but we would like to give you an example of where we have seen PSWs and rehabilitation therapists working together. We will share some challenges and opportunities about applying or using this framework, and finally some recommendations and next steps in moving this research forward.
So we just wanted to start off with some background information. Sorry, I'll advance this time. To provide some context about the PSW role in stroke care. So stroke is the leading cause of adult disability in Canada, with more than 50,000 Canadians experiencing a stroke each year. In Ontario, personal support workers provide the majority of care in long-term care facilities and in home care, as many of you are aware. And so they are spending a significant amount of time with stroke survivors and their family caregivers. However, what we don't know much about is the specific role that PSWs play in delivering evidence-based rehabilitation and community reintegration with stroke survivors and their family caregivers, specifically in the community is where we focus the work. And so that's where the research project that we did comes in. So the purpose of the study was to investigate the potential for PSWs to be more active supporters of Canadian stroke strategy best practice recommendations for stroke survivors and their family caregivers. And this project was conducted by St. Elizabeth in partnership with Red Cross and Red Cross Care Partners and was generously funded by the Ministry of Health and Long-Term Care and administered by the Ontario Stroke Network. So this study had multiple phases and was exploratory in nature, and both qualitative and quantitative methods were used. Our research team not only included representation from the two service provider organizations, but we also had the involvement of frontline providers as research team members for this project, including those listed on the slide. We also engaged a broad range of stakeholders and an advisory committee to guide the research study. And we want to point out that the data in this study was collected related to stroke survivors in a home care setting. However, we do believe our approach and findings to be of highly relevant to you in a long-term care setting as well for many reasons, some of them listed on the slide. So PSWs play a major role in delivering care in both settings, as we know. In both home care and long-term care, PSWs develop relationships and they build rapport with clients or residents as a result of the time they spend with them. And regardless of whether or not a PSW is providing care in home or long-term care, they do always have a set or restricted amount of time they're able to work with clients each day or each visit. And PSWs spend the majority of their time assisting clients and residents with personal care activities in both settings, and they do work under the supervision of a regulated healthcare professional. So this is what's similar in both sectors about the PSW role. And next we'll present our method and results. And as we do this, we encourage you to think about some of the potential differences between the two healthcare sectors, which might impact the transferability of our findings into long-term care.
One of the objectives of our research was to describe the role of the PSWs in an integrated stroke care team. So we started out by looking at what are PSWs doing. We didn't find a lot of research on this, so we wanted to collect some data in providing support to people who had experienced a stroke. We did this by looking at a few sources. We reviewed over 200 charts from both St. Elizabeth and Red Cross clients. We looked at their care plans and the goals and the tasks that were assigned by PSWs and their supervisors. We surveyed PSWs to understand the activities that they engage in when caring for stroke clients. And so we asked them through a survey about their involvement in the rehabilitation healthcare plans to support clients, as well as their perception on how prepared they were, the training and other resources they had to care for stroke clients. We also spoke to clients, families, PSWs themselves, and the case managers, as well as rehabilitation therapists regarding their understanding to gain further insight into providing stroke care. As Justine mentioned, we had an advisory committee who helped us look at the data and reflect on it. And we also looked at the textbooks that PSWs are currently using in their education, as well as a little bit historically to see what kind of education they are exposed to in training in terms of stroke rehabilitation. In addition to looking at what they are doing, we'd also wanted to see what they potentially could be doing to support evidence-based stroke rehabilitation and community integration. So this involved a process of looking at the stroke best practice guidelines and looking at what of those guidelines could be applied for PSWs. And we didn't just consider, there's a section on home and community care, we looked at all areas of the best practice guidelines. We also discussed with our advisory committee and had them reflect on what PSWs could do, and also with our key informant interviews, asking them what their views would be on what PSWs could be doing given their scope of practice.
So, from our investigation, we found that PSWs are and or could be providing care and support to stroke survivors in 13 areas of client care for which there are guiding best practices. And they can support the activities that the regulated healthcare providers implement with stroke clients in these areas that are listed on this slide. So, for example, mobility, positioning, and transfers or communication. There's some others listed there. And through our data, we uncovered that there are 4 main activities that PSWs can do to support the implementation of these best practice guidelines. And these 4 activities have formed the basis for a framework that we've developed to describe the PSW role on an integrated stroke care team. That could be applied to each of the 13 client care areas that we listed on the slide previously. And so the framework, we've named it OCAR framework, which is an acronym that stands for Observe, Coach, Assist, and Report. And so the definitions of each one of those are here on the slide.
So we'd just like to describe for you the framework and how we might see it working. The first piece of the OCAR framework is observe. Through our research, we found that PSWs are the main observers of stroke care client in the home. This slide provides some examples of how we found this in various sources. It seems that the PSWs we heard through the survey were confident in their ability to recognize the signs and symptoms of stroke. And through both the ADAPT process and the interviews, they can observe important factors related to those 13 client care areas, like communication, as this quote speaks to. And the textbooks clearly emphasize that PSWs as the observers for the interdisciplinary team, based on the fact that they do spend the most amount of time with the clients.
So the next component of our the OCAR framework is, and I've missed it, okay, is that PSW role according to the OCAR framework is coach. So our data highlighted the fact that PSWs have more frequent and consistent visits with clients than the regulated rehabilitation professionals, which may be used to promote continuity of care through coaching. So evidence to support the coaching component of the PSW role comes from several sources. Our ADAPT process led to consensus from an interdisciplinary team that the PSWs can provide encouragement and information, emotional support to stroke survivors and their families related to the 13 client care areas. Our survey of PSWs indicated that 90% of the respondents encouraged the use of assistive devices, as well as providing motivation always or a lot to clients and their family caregivers related to their rehabilitation. And in interviews with key stakeholders, the important role of PSWs as coaches also became clear. And I'll read the quote since it's no longer on the slide. Just encouraging caregivers and talking to them, do you want to talk about this? If they want me to ask questions, I'll answer their questions to the best of my ability. If they're just having a bad day and they need somebody to listen to them, that's fine. And that was a quote from a PSW related to coaching.
Next, the framework identified assist as a main activity PSWs engage in as part of stroke care. PSWs can assist with implementing rehabilitation plans developed by regulated health professionals, promote plan uptake, and progress with client and family and caregivers. It was clear through the chart audits that their focus is on the activities of daily living and the mobility. Support for their assistance for mobility also came through the ADAPT process that we used. And also through the interviews, we heard that some rehabilitation therapists saw that PSWs have a unique role to play in providing a continual learning support for the clients through their stroke rehabilitation.
And so the final component of the PSW role, according to the OCAR framework that we have developed from our data, is report. So our data highlighted that PSWs have an important role to play in reporting what they observe about client environments, as well as their preferences, their goals, their needs, their progress, their lack of progress to their supervisors, and they could potentially have a greater role in communicating this type of information with other members of the rehabilitation team. So our charter audit revealed that PSWs could report adverse client events following their visit. Our DAP process revealed that PSWs can share valuable information about client status changes. And our interviews with key stakeholders, a PSW shared her ideas about receiving important information from PSWs as well. So as this was a descriptive study, we thought that we'd just highlight one example of a possibility of positive results when PSWs and rehabilitation therapists work more closely together. So the example we're going to share is the Home Independence Program in the Central West CCAC, where PSWs were engaged as important members of interdisciplinary care teams for 180 elderly home care patients, and were actively involved in care planning, implementing care protocols, and participating in weekly care conferences. And so in an evaluation of this program, patients experienced increased mobility, reduced falls, decreased ED visits, and increased satisfaction. So this is an example of how rehab therapists and PSWs can work in a more structured and integrated way. And we believe that the OCAR framework that came out of our work could be applied and tested in a similar fashion, perhaps in home care, but in other healthcare sectors as well.
Even though this was a descriptive study, everyone likes to jump to implementation. So we did discuss next steps. And in our knowledge transfer activities, when we talked with our advisory committees and discussed the OCAR framework, and in engaging in interactive knowledge translation activities, we picked up 3 themes related to resistance to applying the framework that we spoke about. However, we also heard that these areas in these 3 themes, if there was change in those areas, could make the biggest difference to moving forward in an integrated care. And we predict that probably long-term care may have similar challenges, but as Justine said, we would like you to think about additional considerations that may need to be addressed in relation to your practice in long-term care. The first theme that we saw was related to resistance we may face in applying the OCAR framework is defining the PSW's scope of practice and their accountability. We heard several factors related to this challenge. We heard about PSW's education that can be quite variable depending on where and who is providing that education. We also heard many different ways of describing a PSW and their title and their role, which is the case that they have all sorts of different names. Also, expectations by supervisors, by family members, they're very different depending on who you speak to.
And so the second thing that we uncovered and related to the resistance we may face in the application of the framework was around the awareness of the PSW role. So that we found that the general perception is that PSWs only help with ADLs and IADLs, and many people don't understand the other healthcare tasks they might be associated with. Also, rehabilitation therapists and PSWs do not often have the opportunity, particularly in home care, to interact because they don't typically work with the client at the same time, and there are limited opportunities for them to participate in interprofessional education, and they mainly learn from their supervisor directly or in workshops together. And finally, the role of PSWs in various sectors can vary, so there could be some confusion in terms of what their role entails, particularly when they're experiencing care transitions.
The final of the 3 themes that we identified in our data that we heard where we may encounter resistance to the framework is related to the systems, rules, regulations, policies, and procedures. One area that came up many times was the lack of central way to communicate through the charts. In home care, everybody might have a different chart for the client. Each discipline, the PSW might have their own chart. So we heard that this was an issue. When PSWs are not with the same client all the time, it's also difficult for them to keep up on the needed information and training for that particular client needs. So PSW inconsistency and turnover does create challenges. And finally, the PSW in home care is not accountable to the point of care rehabilitation therapist. So the speech language pathologist or the occupational therapist that's in the home providing direction will not be their supervisor. So that created a bit of confusion about implementing this framework. Sorry. So bringing our research back to long-term care, as Justine mentioned, there are several areas that overlap related to the 2 sectors, but we also wanted to consider what was unique about long-term care in our presentation. First, the occupational therapist assistants and physiotherapy assistants are an integral part of many long-term care homes in providing rehabilitation services to stroke clients and many others. And this is not the case in home care, which only provides physiotherapy and occupational therapy, with the PSWs providing their implementing or assisting with the plans. Second, all providers to the clients are generally located in the same building for long-term care. And as such, there may be more opportunity for interaction between team members. In home care, this is not the case. And third, family caregivers may not be present in the long-term care settings in the same way that we may encounter many clients living with or cared for by family members in home care. So this adds another dimension to stroke rehabilitation with the integrated team. Given this context, we would like you to leave here thinking about the OCAR framework and how it might apply in the long-term care setting, given your unique context and challenges and opportunities that it might bring to integrating the PSW as part of a stroke rehabilitation team.
So just very quickly, we want to leave off with, where do we go from here? You might wonder. We presented a lot of information, and we want to leave you with our key study recommendations in the areas of policy, practice, training, and research. In terms of policy, we believe that we should address the structural issues that prevent PSWs from explicit inclusion on the integrated stroke care teams. For example, Sandra mentioned the charting issues. In practice, we want to recognize that PSWs are already playing an important role in observing, coaching, assisting, and reporting on the rehabilitation and reintegration of stroke survivors. For training, we believe we could improve training of PSWs and rehabilitation professionals to enhance their ability to work together on the care for stroke survivors and their caregivers. And lastly, in research, we hope that we can test the Observe, Coach, Assist, and Report framework for describing the PSW role in an integrated stroke care team, and perhaps not only in home care, but other sectors as well. And so we'll just leave you with a link if you would like more information about this or any of our other research and our contact information. Thank you.